Although it's likely going to be me closing the place, considering that you are knowing either. Oh. Well, you don't have to. If you're gonna go home early and hang with you.
Got people online, by the way. That I didn't.
Yeah, we got 5 people online.
Oh, yes, can't wait to get my ass kicked by a 10-year-old.
Look at Minecraft. All right, we're about to get started. Thank you for being here, and thank you for being online. My name is Mario Romero. I'm an associate professor at KTH. I'm the associate director of seminars and workshops at Digital Futures, and also the national technical manager of InfraVis, the infrastructure for data analysis and visualization. It is my honor and pleasure today to introduce my friend Lonni Besançon from Linköping University, where he is an assistant professor. Lonni is doing research in volumetric data visualization and also in understanding better the statistics in research through work in visualization. But today he'll talk about another work that he's doing in keeping us honest when we publish research, both when we use AI to publish research, but also by using AI to keep us honest. Thank you.
All right. Thank you, Mario. Righty, so yes, as Mario said, my background is not on most of the things that I'm going to talk about today. I did a lot of work during my PhD on how to interact with volumetric data, how people could use specific techniques for specific domains like fluid dynamic, medicine, et cetera, to understand that data. I also worked a little bit on immersive visualizations and how we could try to render some data maybe a little bit more entertaining and interesting for students to get into with this prototype, for instance. But that's not what I'm going to talk about today at all. I have had a keen interest in methodological work for a long time. Already back during my PhD, I was looking at how we could do statistics better because people in my field were not particularly good at that, me included, right? That pushed me afterwards to go into other things like open science. I think most of you would know this logo. If you don't know it, do not use Sci-Hub to get access for free to all papers. Really, do not do that. But then I looked into other like more meta research topics like the replication crisis and how it could be a threat to our research, in my field at least, right? And that pushed me into thinking more about the whole like publishing, let's say, sector, and how we work as scientists. And so just to make sure that we all agree on how things work usually so that we have common vocabulary, this is usually the pipeline for publishing a paper, right? Like you write your draft after doing your experiment, collecting your data, whatever. You send it for review, and you get hopefully just one round of peer review. That rarely happens. Usually it's multiple rounds of back and forth with reviewers and editors until eventually someone says, okay, your manuscript's good to go. We should publish it. There's some editorial processes, some copyright handling and all of that. And eventually a paper is being published and accessible to all. Now that's when things work well, right? Like paper is going to be used and cited, and in 15 years you'll reminisce thinking, oh, that was great, what a cool paper that was. You get an award for it somehow, maybe, whatever. But there's moments where this goes wrong. And when that happens, there's a couple of options that are available. If someone, yourself included, finds a mistake in a paper, the editors of the journal can issue what they call an expression of concern, saying we will investigate this issue and try to see if there's anything that we should do, correct the paper maybe, or if it's actually nothing and it doesn't really matter for the results, or worst case scenario, if all that was done is actually not valid anymore, and in this case we retract the paper, and so it's not available anywhere anymore. All right, so now into the whole topic of research integrity, and I'll dive later into the whole like AI part of it. Usually the best way, I think, to kind of get people interested in something is to go through personal stories. So I'll tell you mine, an interesting, I think, and hopefully kind of like inspiring story. That started with this little thing here, a great visualization of a virus, so the COVID-19 virus and the pandemic that happened now something like 4.5 years ago. This what used to be a great platform that has now changed logo and name, but I'll call it Twitter, I think, until the end of the platform, which should happen soon at this rate. But anyways, I was just, it was the beginning of the pandemic. I was working from home and seeing all these news about papers being retracted, about big scandals in research. And I thought, well, I have a good understanding of statistics now. maybe I can do something to help. Maybe I could look into some of these issues that have been found and see if there's anything more systematic to it, something that we could contribute with my background to make things better. And in particular, this one paper here caught my attention. So does anyone see anything wrong with this paper? As of just what I'm showing you here, do you see anything that is wrong? It's all on this page, it's nothing else. There's actually 2 issues, but you can only find one yourself.
Within a day.
It was accepted within a day, right? So it was peer-reviewed and accepted in 24 hours. I don't know how many.
2020. We did this in 2020 for COVID papers.
We did do that in 2020, absolutely. There were actual guidelines from some journals saying we will fast-track the peer review process, sometimes completely remove it, actually, just to publish quickly because people may need it, right? And in this case, it's a clinical paper, so actually would make some sense. Now comes the second potential red flag. So going past the date. Second one is here on that name, first name, Philip Gautret. Philip Gautret is a researcher who has, I think in this journal, he has the role of editor-in-chief of the journal. Now, could be completely fine. Editors publish in their own journal, that's fine. With an expedited peer review process, maybe not so often. But again, maybe that's not a problem. The thing is, we don't have access to peer reviews records, right? Like we don't know what the reviewers said about this paper, how it was reviewed. And this is actually proper clinical research. There's a clinical trial in there. So how can these be peer reviewed really? Because they do claim it has been peer reviewed in a single day. We don't know. Was it thorough, not thorough? And I thought, I'm going to look a little bit into this team's work because they were claiming a lot of very intense things about COVID, that it was the easiest disease to cure ever, that we would be done within 2 months, there would never be a second wave, and there was no reason to panic. It was just a couple of people in China dying. I'm just quoting what they said, right? Like all of these claims were made. So I was like, all right, I'll look a little bit into what they've done. And so you see the middle column here is the peer review time of the COVID-19 papers. If the cell is in red or pink, whatever this shows at, this is actually peer review, including revision of the paper. What's a little bit worrying is there's a couple of 1s in there. And there's even a 4, including revision time. That's extremely fast. Like we're talking about an institute that had to deal with patients as well. How can they manage doing something so quickly? Interesting. The rightmost column is actually the column that contains editorial conflict of interest, if any, right? You see that most of these cells are not empty or not containing NA, so there's plenty of them. Again, not saying it's fraud, not saying it's cheating or anything, just saying it could raise some red flags. And so I posted this online at like 4 a.m. or something, and woke up the next day to something like 400 notifications on Twitter with people telling me like, oh, you should write to the editor-in-chief to sort this out. I'm like, well, you should read this graph better or this table better because the authors are the editor-in-chief or editors. So obviously writing to them is not going to solve much, but I'll try. So I did try, didn't get a response. And then people were saying, oh, you should write to Elsevier. It was an Elsevier journal, which made me laugh. I mean, I don't know how often you've tried to write to the Elsevier research integrity team, but I can tell you they do not answer, like almost ever. But some other people had an interesting idea. It was to actually try to automate this check, right? Like how long were papers like reviewed for? Like was it just a day systematically overall? Was it like a couple of exceptions? How can we know? So I did that. That ended up being this paper that was published eventually, I think, in 2021. So peer review took more than a day, I can tell you that. But we had a couple of findings in there, and I'm going to show you just some of these. The one is that we actually separated papers between like real full research articles and more like opinion-oriented papers and all of that. And we actually found 224 papers peer-reviewed and accepted within a day or like 24 hours or less. Out of which, for 31% of those, we actually found editorial conflict of interest, right? Which is a pretty high number. Again, there's no peer review report available. We can't check how this was reviewed, what it actually meant that it got reviewed and all of that. But we're talking about full research article with new results that should have been thoroughly reviewed, right? So not great. In the paper, we detail a lot more issues we found during COVID and some of the solutions that we think are about transparency and open science methods and all of that. But I'm not going to go through those because that would take ages. Okay, now, does anyone know this website? I guess Philip knows because I've shown this slide before, but anyone else knows about this? PubPeer? No? Okay, so PubPeer is for post-publication peer review. It's a website in which you can comment on a paper that has already been published, right? So either a preprint, that's also fine. You can comment on a preprint. You type the DOI in the search bar. It will show you like often a column here with 0 comments if there's never been a comment on it. And you can comment on it. Anything you have to say, right? It could be there's a dead link in your paper. Could I get access to something updated? It could be, thanks for this paper. It was really cool. What about this? What about that? Or it could be, well, this paper was reviewed in 1 day. How did that happen? Plenty of stuff you can do. One of the things that is pretty cool about Pub here is that they have a Google Chrome extension, and I think Firefox now. So you can actually download it, and whenever you read a paper, it will actually go and fetch on your web page the DOI of that paper and tell you if there's comments on Pub here. So before you try to use that paper, you can see if other people may have raised concerns on it, right? Which is pretty cool, right? Like that avoids the whole burden of like using this for your research and then 6 months later realizing that, oh, maybe you shouldn't have. So it's a pretty cool thing. Now this one, Retraction Watch. Anyone knows about this? Retraction Watch is something I open daily. It's a website started by Adam Marcus and Ivan Orensky, both surgeons in the US, and they were a little bit tired of the kind of lack of accountability of publishers and editors when it came to issues with research papers. So they decided to create this kind of non-profit to push for articles about problematic papers and the lack of actions of editors. So I go on it every morning when I get on the train. It's the first thing I open on my browser with Twitter. Can comment about the Twitter thing, but this is pretty cool. There's lots of stories about researchers who faced issues, even like on their own paper, sometimes when they realize there's a mistake and they try to get it corrected and they can't. And Retraction Watch will report on those. Okay, so throughout the whole pandemic, I decided to look a little bit into problematic papers, as I said. I found a couple of those, and before again we dive into like how these scales with AI and other methods, let's talk about different examples. This one was a paper on lockdown, published in Scientific Reports, so it's like the flagship journal of Nature today. They publish something like 35,000 articles per year, and it's around $10,000 per paper, so I'll let you do the math. That's a lot of money, plus other stuff, of course, that they're doing. But anyways, this paper was looking at the effect of lockdown on the number of cases of COVID, and in a kind of convoluted way, they showed that the lockdown and all kind of like restraining measures, non-pharmaceutical intervention, as they're called, do not work to reduce the number of COVID-19 cases. Now, I'm not an epidemiologist, but if you have an airborne disease and you put in place something that pretty much makes people not meet as much, you kind of expect an effect on the number of cases, right? Like maybe it's not worth implementing because of other issues. That's something we can discuss. Maybe the effect is small, but you expect an effect. You should find something, even if it's marginal, right? They didn't. So that kind of like attracted my attention for a while. I was like, how can they not find any effect, right? So the way they looked at it, and they're with me, it's their vocabulary, their method, is they looked at the increase in the decrease of movement, which is a very weird way of framing that, and the effect that it had on the number of cases, right? And so I got that and I was like, oh, it's perfect. They have a model and they throw in like data and they checked if there's actually an effect, right? So I can create my own fake countries with fake data, throw in their models and see if it actually detects an effect when there's one, because I created data set. It should, I should be able to create something that shows an effect and see if their models can find it. Spoiler alert, it didn't. So we wrote to the editors because this paper had a massive impact. It was shared everywhere in the news, on Twitter in particular, Facebook, all over. It was actually the article that was used in Brazil, because the authors are Brazilian, to stop any kind of non-pharmaceutical intervention from the government, right? Which we know what it led to in Brazil. So not great. Anyway, we write to the editor because we had all their models, we could use them. We said, well, we tried to use them. We tried to create a fake country. It didn't work. And that's really problematic. So we summed up all of our concerns in a preprint, posted it on papier, sent all of that to the editors, to the authors separately. And after back and forth for a couple of months, we got an answer, a final answer from the authors saying, oh, you cannot throw fake data into our model because something, math, something that I don't understand. I was like, all right, I'm not a mathematician, so maybe I'm just too stupid. We shouldn't do that. Fine. But back when we had this, so we were like talking September 21, I think, when they replied, we already had the several waves of COVID, where the number of cases going up and down multiple times. So instead of creating fake data, I just took real data, right? Like number of COVID-19 decreasing for between wave 1 and 2, and the increase in the decrease of mobility from real data again, and just did a time offset, right? And then I put that in our model, and it didn't find an effect either. Turns out, fast forward December 21, the paper is retracted, and they publish our response first, and then they publish a mathematician's response to the paper, and then we retract it. It's covered by Retraction Watch. But the damage is done. It's too late. It took 10 months. The lockdown in Brazil was stopped. People died. Not great. Another big paper, also looking at lockdown, that also made the news heavily. If you look at the numbers here, 70 news outlets talked about it. Finding the same kind of things, lockdowns don't work at all, full stop, no effect whatsoever, written by a big epidemiologist, John Ioannidis. So everyone took their results at face value saying, oh, this guy can't be wrong. Turns out it was. But published our concerns there on PubPeer. The editor published our response, but eventually they just responded and paper is still online. Another one here that's a little bit tricky is this one. This is probably the most impactful paper I've reported ever. Back when I looked, it was number 13 of the list of papers the most shared ever. So really big impact, 34 news outlets, 40-something thousand tweets. It was really big. What they were looking at in this one is whether or not the number of COVID-19 vaccines given actually reduced the number of cases, right? Which, again, was not the point of vaccines in the first place, but whatever. And they write this here. There appears to be no significant signaling of COVID-19 cases decreasing with higher percentages of population fully vaccinated. And usually I'm very happy when I read this, especially this part here. There appears to be, they're hedging a little bit their findings. They're not being super strongly sure about this. I'm like, oh, this is great. Yeah, not so great, actually. Because this sentence just stems from looking at this figure. They did no stats whatsoever. They plotted this, and they said, it doesn't seem significant. And they just published that. And I know that because we actually redid the analysis. It was published on the 24th of December. How to not to make noise about a bad paper. So obviously no one read our response. But we did the test for them, and it turns out they were very wrong. You see the p-values that we had. Extremely small. It's very significant. But they didn't do the test. The paper is still published. So I've shown you 3 problematic big papers. There's only 1 retraction, 2 publications of rebuttals. It's not great, right? We're not really correcting some of the bad science we have. But it goes further than these methodological problem. And I'll show you some of these going further. This was a paper, again, looking at COVID-19 vaccines. And it's a review of the literature. So they surveyed all papers. It's a narrative review. So they decided on a list of papers they wanted to include to fit a narrative, and they published that. And they conclude on this paper, if we go further down here, yes. In the end, billions of lives are potentially at risk of cancer, that's what they're saying, given the large number of individuals injected with the SARS-CoV-2 mRNA vaccines. So they're saying billions of lives, right? So at least 2 billions, which is a third of the planet, at least. I think this was published in 2022. We would know by now if that was the case. Obviously, this is wrong. And it's wrong for many reasons. Again, as I said, it was a review of the literature. And if you look a little bit, they write here, for instance, talking about mRNA vaccines, that vaccination has been demonstrated to suppress both IRF7 and STAT2, See Liu et al. 2021. These things are kind of linked to cancer. And so I look at this Liu et al. Paper. It's in Cell Discovery, good journal for the field. And oh, look, they're not looking at mRNA vaccines. They're looking at inactivated vaccines. Interesting. So this sentence back in their paper is actually misleading, right? This paper didn't look at COVID-19 mRNA vaccines. It looked at inactivated ones. And it turns out the whole paper, 185 references, I think, from memory, they do that for more than 140 of them. They mislead the readers about what the authors actually found in their own paper. We went to the editor. Nothing happened really. Eventually, they didn't publish our response, but the editor-in-chief decided to resign. They actually said he was forced to resign. And they gave an interview about this in a QAnon journal called the Epoch Times. So I think that says a lot more about him than it says about us, because he tried to diss us in this response. Final one from Nature again, scientific reports. And here, maybe some kind of interactivity. It's not a great paper. Do you guys see anything wrong with this? And then some VISP people in the audience, so I expect you will see at least one thing wrong. And while you look, there's 2 things wrong, I can tell you that. While you look, I'll tell you some background. The red line here shows the number of what they call cardiac arrest calls, so calls made about people having cardiac problems that need urgent care. And the other 2 lines that are kind of big, like a purple and blue one, is the COVID vaccine rollout, pretty much, those 1 and 2. And so what they're trying to show is that the vaccine causes heart problems. Now we know the vaccine causes myocarditis, pericarditis, but they're talking about something a lot more severe than that. All right, and if anyone see what's wrong with the graph?
Well, we don't start at 0.
Yes.
This.
Yes. God.
At least on the left one.
On the left
Anything else that you would see?
Yes, so we should have started at 0. And if you do, I did the replotting of that.
Yeah.
It's a lot less dramatic of an effect, obviously.
Okay.
The other thing is it starts here. You see the date, 18th of October.
October, yeah. Oh,
2020, right? So they're checking a pandemic era, post-vaccine to a pandemic era. But they didn't check pre-pandemic. What was happening pre-pandemic? If you want to show something about the vaccine and not about COVID, you should actually check pre-pandemic, which they didn't. And they didn't for good reason, right? Turns out this is data from Israel, and the Israeli government actually published a rebuttal of that paper on their own website for the health minister saying, this paper is obviously wrong because in March 2020, the government made a release, like an actual intervention saying, do not place cardiac arrest calls. So this decrease, this very low value that we see here is from that. If you go back in time, pre-pandemic, this red curve would be around here all the time.
or they were not allowed to call in emergency service.
Exactly, because the hospitals would just be overwhelmed. So they were like, they're not going to be taken into account. You're just going to bother personnel. Do not place these calls. That's it. And people kind of did that, right? So if you go back in time, you see there's like a value here, around here all the time. And then it decreases right in March, it goes there, and then it stays around there-ish. And I mean, for a government to publish a rebuttal of a paper, plus all the statistical errors they have in their paper, you would think that the paper would get retracted. It didn't. It got massive again. We got a little bit upset at this paper. We actually submitted this to the editor saying, you know, there's a strong correlation between death by swimming pool drowning in the US and Nicolas Cage's apparition in a movie per year. If you think this is a spurious correlation and you think this shouldn't get published, then do not publish this kind of garbage paper. Obviously, the editor-in-chief didn't really like this response, so they didn't publish it. They issued a small correction to the figure. Now the figure starts at 0, but the rest is still published as is, forgetting the whole issues about the data analysis that they couldn't have done, but whatever. All right, continuing slightly on the personal story before I dive into more systematic issues. Some of you may know this person, Elizabeth Bick. So unlike John Ioannidis, she's also my hero, but she actually delivered during the pandemic, unlike John Ioannidis. She's really amazing. She's been highlighted in science outlets for a while because she has found a lot of image duplication in papers. And she looked a little bit into these guys' paper. So he's the one who promoted hydroxychloroquine during COVID with this paper that I showed at the beginning. And she reported on a lot of his papers for different issues, image reuse without proper approval, lack of ethics approval for some of the studies that were conducted on humans, taking images from other papers of other people and putting them in their own without giving any credit whatsoever, a whole range of issues. So she flagged these papers on PubPeer, and if you flag a paper on PubPeer, if you put a comment, the authors will get an email. And so she did that for 135 papers of this team's work. So they got 105 emails, automated, obviously. And so they said that it was harassment. So they sued her for harassment because, you know, of course, that's the only scientific response. And so we learned about this, and with some friends and colleagues, we decided to write an open letter to defend post-publication peer review in the work of Elizabeth, saying pretty much, you know, we are, as co-signatories, dedicated to transparency and integrity of research, and we think that science discussions should not be held in a courtroom, ever. If we're discussing the science, then discuss it on scientific outlets, not in front of a judge. And that got pretty big. It was mentioned everywhere, which was good because Elizabeth got a lot of support. And actually, I talked to her in person for the first time 2 months ago, and she was like, well, you know, Didier Raoult should realize that this guy who promoted hydroxychloroquine, that he made my career so much better thanks to the law case that he started against me that he, of course, lost. It was completely dismissed. But before he did this, I was semi-famous. There was some news article about me, but that was it. And since then, I have an interview with a journalist every other day. So thanks to him, I have a proper job now. Before I was just doing that and trying to make ends meet kind of every month through my Patreon account. Now I'm just I'm a science integrity consultant everywhere, so great. But there was, of course, some fallback for me because I co-wrote this open letter, and this guy called me pretty much terrorist on his own video on social media through his institute, so not so fun. And then some of his followers were very nice with me, sending messages and calls that are not the best to receive, but that you get used to eventually. And so that actually pushed me to look into some more of their studies, actually, with this paper where we looked at the ethics approval of some of the things that they had done. And in particular, someone told us and I'm not going to say who that was, to look into, and I think we write it somewhere, yeah, here, the IRB number, so the ethics approval number 09-022. So we did that, we put it into Google Scholar, and we found 300 different papers mentioning it, all of them from this institute. After removing all the duplicates for Google Scholar, because preprints and papers are two different entries. So we did all of that, we removed, and then we end up with a list of 248 papers using that ethics approval number. Then we read through these papers and we're like, what are they talking about? And this is the whole breakdown of what the papers contain. So most of them contain some stool samples that they took from participants, but there's also blood sample, urine sample, breast milk sample, vaginal sample, all of that. Which then makes you already wonder, like, how can they get ethics approval for all these kind of samples being taken on humans, right? Like, that's a pretty wide range. All right. Then you look at who they took samples from. Sick kids, healthy kids, sick adults, healthy adults, and you're like, okay, these do sound like really different studies, right? And I'm not even talking about what kind of sickness they had. It's also another thing. But that would make this too complicated. Then we looked at where they conducted the study. Institute in France, you would expect this IRB approval works for studies in France. Tough luck. It also worked for studies abroad and in France, and many other categories that are a little bit weird with like no, because we further categorized into like, did they get ethics approval also from the other government that they conducted the study in, kind of. And so we dive into all of that, and we looked at where these studies got published, and they got published mostly in this journal, NMNI, New Microbes and New Infections, in which they had editorial control, complete editorial control. So that makes retracting these papers very difficult. And again, as I said before, Elsevier is not very keen on investigating those, despite the report of 200 papers with the same ethics approval. Eventually they did. So yeah, I already talked about the whole like publishing within their own journal, was already mentioned here, but we're not the only one who picked it up. Another team, independent of ours completely, also found this. So, with all of these concerns raised, we emailed all the editors, we emailed Springer, Elsevier, everyone that we could, where all these papers got published, and eventually this got the attention of science. So they made a whole article on how things went down with this institute for years, starting with the amazing work of Elizabeth and Fabrice, the one who did all the data analysis, and they have very interesting profiles. I invite you to take a look at this article. It's pretty cool. I mean, Fabrice is a surfer. That's pretty much his job now, according to him. And Elizabeth, well, she's a scientific integrity consultant. And the article is pretty nice because it actually relays the whole story of who got involved and how. So Elizabeth was, of course, insane here. There's also Matthew Molimar, did a lot of extra analysis on the COVID-19 papers. And then she also goes, Kathleen O'Grady from Science, into the role that Victor Garcia, a journalist in France, actually did in uncovering some of these things with us, and also sticking his neck out already in 2021 when we had found all of this and no one wanted to talk about it. It was the first one to actually publish on this. I can tell you his bosses were happy about the fact that the article got to be like a bomb, but also not so happy about all the threats that they received after that. But anyways, looking at all of these things, with Elizabeth in particular, we have noticed that it's extremely hard to retract papers and to get actions on papers, even if they concern healthcare and taking care of people, human lives directly. And we give a couple of guidelines here on how we would like things to work. But the most important thing, I think, and I'm talking scientists here, is that we should change the way we think about retractions, right? Currently, we see them and we do them only in extreme cases of fraud, which in itself is bound to be kind of like a failure all the time. As long as we see retractions and corrections only for extreme cases of fraud, we will not retract or correct papers that have just, tiny mistakes, but deserve to be corrected or retracted. And we won't do that because otherwise the career of researchers will be impacted. And we don't want that, therefore we don't do it. But it's a self-fulfilling prophecy. So we need to change how we view these things. All right, now into the AI part, slowly. This is a table. Can you spot anything weird with it? I'll tell you a little bit more about the context while you look. I can tell you it's not in the T or P value columns. It's in the group 1, group 2 with the N's. I'm helping you out. There's something really odd there that humans are pretty bad at picking up, actually, but an AI would be very good at. Actually, programs already detect that. Some context, this is table 1 for a medical paper in which you pretty much say, my 2 groups are comparable, therefore I can put 1 in a treatment group and 1 in a placebo non-treatment group. So do you see anything wrong? It's on the ends. Also, yeah, it's not great quality. To publish in this journal is $2,000. and they can't even provide you a PDF of tables. Great. It's a PNG, yeah. So not my fault if it's really bad quality. Do you guys see anything? No one?
I have a few zeros, perhaps.
There's a lot of zeros. Actually, you can push it further. There's no odd numbers. Absolutely none. What is the likelihood to see absolutely zero odd numbers in these two columns? I mean, I can tell it's pretty low. And I can tell you after further analysis of the paper that the whole paper is fake. Everything. It's supposed to be a clinical trial on whatever, I don't remember. Doesn't matter. Everything is fake. There hasn't been a single patient, nothing. Actually, 2 of the authors don't exist even, so there you go. So it got retracted. Another one. Now it's not a table. This is a preprint I'm showing you because the paper got retracted already, so I can't find it anymore. There's something odd in this very little paragraph. So I invite you to read it and to tell me if you see something. It's not the fact that it's super hard to understand or hard to parse, it's something else. No one?
I don't like the grammar.
Right, the grammar is horrible, right?
Yeah.
But it's not that. Although that's a sign that something is off. But you could think first, I mean, non-native speakers, you know, that happens. Mario, you have an idea?
Well, it's still related to the grammar. It doesn't have a verb. It's not a sentence.
Oh, yeah, there's that. I mean, it also, yeah. So there's that. But the big thing here is this one. Lyme sickness. I mean, again, I'm not a doctor. Lyme disease is something that people say. It's the accepted term. Lyme sickness is not. And you could think, okay, just non-native speakers. But I mean, even if they're not native, they should know about their own field's keywords. I'm not native, but I know that it's called a database, not a base of data, right? You know, but okay, let's admit for now that it's just a non-native speaker. It's not, by the way, but it's something else. It got retracted, as I said. So you can't find the PDF anymore because they decided to just completely withdraw it, but it doesn't matter. Another example here, do you see anything wrong? There's a couple of stuff, a little bit like the Lyme sickness ones, and this one. Humans are not really good at picking them up again, but it's not impossible.
Do you call it man-in-the-middle assault?
That's a good one. Yes, man-in-the-middle assault. It's not that, right? Nope.
Is it a man-in-the-middle attack? Right?
It's attack. Yep. There's multiple in this. So I'll highlight a couple. I don't know which one I put because I can't remember. Oh, yeah. See, I didn't even put the manage. Keen gadgets. What is keen gadgets? What is that? Man-made consciousness. This one is easy to guess. It's artificial intelligence.
Cool.
So yeah, this interesting. Very hard to parse again because most of this doesn't make any sense. Another example. So I'll just give you. It's in the first 2 lines here. Again, very hard to parse. But do you see anything that's odd?
What is a wellspring? I don't know. I don't know. Maybe that is a thing.
I think it is a thing, but I'm not even sure. There's so many. Maybe that's one to look into, actually. Here's the kicker. Dietary filaments. What is that? What is that? So it turns out all these things are called tortured phrases. So you see dietary filaments actually here, and it stands for, or you actually don't see that, but it stands for fiber. There's a lot more of these in the paper, such as insusceptible framework for immune system, or invulnerable framework for immune system, or resistant framework for immune system again. And so these things exist for a reason. When you're a surgeon in particular, but not just, but when you're a surgeon in developing economies still, so you have a pretty good salary, but as a researcher, you're expected to publish 10, 12, 15 papers. Like it's a hardcore criteria you can't budget, right? And these 10, 15 papers are on top of your clinical duties and teaching duties and all of that, like supervising your interns and externs and all that crazy stuff. And you have a good salary, you live in a country where it's not too expensive to live to begin with. So you could, use some of that money, instead of doing the research, to pay someone to write a fake paper for you. And there's companies, entire companies, dedicated to building, writing, submitting, getting accepted fake papers. They're called paper mills. I mean, it's all in the name. So they're just going to churn out papers for you to put your name on. And they do the whole thing for you, the submission, everything. You don't even have to worry. You pay $1,500 and they take care of all of it for you. But it turns out for this price, I mean, if you hire scientists to write a paper, it'll cost a lot more than $1,500, right? Like a lot more. Your time, everyone's time here is a lot more expensive than that. So they hire undergrad students or people that are absolutely not qualified. And these people, what do? They copy from existing paper, copy paste. And to not be found by the plagiarism check, they use a software that replaces every word by a synonym. Every single word, including artificial intelligence, man-made consciousness. There you go, including, there was another one. Natural language processing became herbal language processing because nature and herbs, they go together. So some of the kickers could be that they would mention, for instance, superficial cognition is another one for artificial intelligence. So superficial cognition, parenthesis, AI. Ha! Yeah, so these things, they are called tortured phrases, and it's pretty much the definition of like having an expected sentence that is transformed by the synonym software into something that is close to nonsensical. And that is a sign of a paper mill very often. So you see here that Nick White posted on PubPeer saying that we found tortured phrases, and at the end of this comment, he actually acknowledges this guy, Guillaume Cabernac. It was Nature Top 10 of 2021, and he created a software. He has an agreement with a company called Digital Science, which works with Nature, and they have the main text of all papers published with a DOI. And so they have an API that you can connect to if you pay a lot of big bucks. But they got an agreement to do that for free and to highlight all the papers that would contain any of the tortured phrases that he had identified. Now, the cool thing is, you find a paper with tortured phrases, you can find another one, tortured phrase, inside that paper that you didn't know about. You're like, what is this term? It's nonsensical. And then you're like, could be that. And then you add it to the list, and then you rerun the whole search through the API, and then you get to, finding more and more papers. So he did that. You see the problematic paper screener, that's how it's called. And so I think together, because I work with him sometimes, we have signaled with the simple approach, something like 45,000 papers already containing those. And now you would expect that, they're just published in crappy journals and all of that. Yeah, we signal 70 papers in Nature Scientific Report. 70, right? For the flagship journal of Nature. That's not okay, right? Because like any peer reviewer would see that and be like, come on, this is nonsensical. That should never be published. So that means some editors are probably in on that as well. Pretty bad. So again, here, the only thing that we do, and the way we do it, is that we use this software, very simple. It's not even AI, right? We have a list of words that we look for in the main text of all the papers that are published. And once we have a return from the API, me as a person can be like, okay, this paper was flagged. I open it. I look at the PDF, I try to find one of these tortured phrases, I take a screenshot, I highlight it on the screenshot, then I post on PubPeer, and I list the phrases that have been found automatically from the software, and then the paper is flagged, and then I move on. Then there's a tool with PubPeer, with this, that allows me to send a journal report to the journal directly. IEEE got a lot of emails from me about that. But Guillaume then extended it. There's other things we can do. Once papers are retracted, what happens if you cite this paper that has been retracted? Is it a problem? Maybe not. Maybe you just cited saying, people have worked on this and it's kind of a throwaway citation. But if you're using the methods of a paper that has been retracted, maybe we should look again at your paper. And so he created what he calls the feet of clay detector. So, they're standing on the shoulders of giants with feet of clay kind of metaphor. So every time there's a paper that has been retracted, we can rerun that search and find a lot more papers that relied on these retracted papers. And if there's like 2 dozens of retracted papers in your references, then definitely something fishy is going on. Now, Guillaume, I also found more and more stuff. So if you go on Google Scholar and you open quotes and you write, as an AI language model, I cannot, you find hundreds of papers, hundreds. And he did that. He also looked for regenerate response, because people copy paste the output of ChatGPT, including the regenerate response button in a paper. You can also do it with, as of my last knowledge update in, and then that will be something else, like different years and months, and you'll find another 100 of papers, and it's kind of scary. And we can just signal them on PubPeer, we have, and that was kind of the only way to detect obvious ChatGPT generated papers, right? Because all these tortured phrases and paper mills and all that was like stuff done 10 years ago, before we had LLMs, or working LLMs. But nowadays, the next step, like people can just generate completely fake papers with just like clicks. And of course, people have been doing it. It's just some of the not super smart people doing that we can easily catch. Guillaume also found it in peer review reports. Some journals publish the peer review reports, and sometimes you find traces of ChatGPT also in peer review reports, which, if people just use them to hopefully make sure that they're not being offensive in their review, that would be okay. But often it was not the case. It was really completely gibberish reviews. And it's now actually an approach that's been done by some folks to try and detect ChatGPT use beyond the obvious, people copy-pasting stuff that they shouldn't have copy-pasted. This approach was a little bit tricky. What they have done was look at abstracts of a single journal over time and try to look at, we know from analyzing ChatGPT output that it really likes some verbs that humans do not tend to use so often. For instance, delve into. It's something that is super rarely used by humans and very, very often used by ChatGPT. And so you can just compare the frequency of delve into in the abstract of papers across years. And they did that for a couple of journals. And you see something like LLM or ChatGPT 3.5 is released, and all of a sudden there's a big spark in this one journal on all the abstract of delve into, which means that at least ChatGPT was used. Doesn't mean that it was misused, but it was probably used for some stuff in there. And then you can start digging a little bit more into all of these papers that have the delve into, for instance, and try to see if there's something fishy with them beyond the obvious use of delve, which almost no one uses. Actually, it's pretty sad for some of the researchers that love using it before. They can't use it really anymore, right? If they're smart, they shouldn't. But there's been, of course, other stuff being done with the help of AI tools. There's this, I think it's a startup that's been trying to use some machine learning algorithms and some basic data analysis to flag papers that contain potential misconduct. So they use different heuristics. One is, do the authors have retracted papers in the past? That's one heuristic. Another one is the number of references, how many of them retracted or not? Another heuristic. And then they also look at co-authoring networks and all these kind of stuff, and they try to predict if this paper should be investigated by humans further. Because that's the problem we're having with all of this. There's a mass of papers and we can't keep up, right? Like, I can't read every single paper to know if they're legit. And I don't expect anyone to be doing that. But maybe if I can find some ways, smart ways, like, having some kind of like informant from the police, right? They can't listen into all the criminals at the same time. But if an informant is there and being like, check out tomorrow at this bar, 8 p.m., then they can do that, right? So that's the kind of same approach here. We want to be able to look at specific journals or papers or author networks, for instance, to try and find out where we should look more. And Elizabeth's work that I mentioned before, she's doing something else than just looking at words. She actually doesn't care. She often doesn't read papers at all. She only looks at images. She got very famous on Twitter for doing these image forensics tests. So the idea is that she would post an image and say, there's something off here. Can you find what it is? So I'm asking you the question, can you find what it is? I'm going to give a hint. She specializes in image duplication. That's the biggest hint I can give. Second hint, it's not on the top part.
Is it better actine? Is the two images, are they identical?
They are exactly identical to the pixel. And they shouldn't be, right? I mean, it could be a simple copy-paste gone wrong.
Yeah.
Or something else. And so she's really good at that. She has flagged, I think last time I checked was 9,700 papers for issues similar to that one, which is a lot. She's really good. So people actually also try to trick her. Like, can you find the duplications in this bus seats? And yeah, she can. She's really good. She's really, really good at it. She finds them all. And she does this, like, this is naked eye stuff, right? Like, most of the time she doesn't use extra software. She usually uses extra software to verify some ideas she's had.
So she's just good with her eyes, basically.
Yes, all of that. And I mean, she does it on, hotel floors as well. She's really good. She's really good. She's super talented, right? It's insane. If I was a vision scientist, I would want to study her brain, I think, so bad. But yeah, she's really amazing. I mean, she's amazing to the point that, like, she would see that and find duplications in it. And I challenge you to try to find any duplication in this. I never could.
She was showing us there it is.
Yeah, she can. So she would use contrast first because it makes some of these points a little bit easier to see and all that. So now she uses the specific software because it was really hard to find. But it's really a lot of reuse and across different images. It's a little bit crazy stuff. And most of us can't do that. It's so hard. Mario, yes.
If you look at the
magenta here, for example, it looks like there's a rotation.
Yes, they are rotated too. Of course, it's not just copy paste.
She finds this with the negative.
Yes.
Ah, that's why the blue one is also rotated or something.
Yeah.
Yes.
I was like, that's not identical.
No, they're not exactly identical. And that's where it gets tricky. Sometimes researchers doing that, they take an image and they will scale it in just one direction, right? They will scale like to the right, scale to the left, up or down. So the image would be distorted.
Right.
Sometimes then they cut apart.
Are the images sometimes shared also?
Yes,
Because
absolutely.
the cyan square seems to be
Yes,
a little bit shared in the vertical direction.
it is, exactly. So it's
And it's
super
meant to
hard.
be different images.
It's meant to be different images,
Yeah.
results of different experiments. So there's no way that this happens. But it's advanced, right? This is super advanced. How can you figure this out? I mean, she's amazing, but how many Elizabeth Beck can we come up with, right? Like how many people can spend time on this? Fortunately, we don't have to have too many Elizabeth Becks because the software helping us. This is flagged on up here, and it was found by a tool called imagetwin.ai. So as the URL kind of hints at, it's using some AI algorithms. And you see, it's actually, in this case, the exact same images in two different papers, 10 years apart. So claiming to be completely different papers, but the images are the same. One in 2013 and one in 2023. Oopsie.
And does this fool like regular software to check for plagiarism?
Yes.
Okay.
Yep. And it actually accounts for any kind of small-ish manipulations, so rotation and some scaling, some weird scaling stuff, but not, of course, everything possible. But it already does flag a lot of things that then, again, humans can just go and verify and say, okay, is this paper really problematic? And on top of that one problematic image, can I find more things on the side that are also problematic? And often when you have one of these hints, then you find a lot more, like fake data, like offers that don't exist, et cetera, et cetera. And, now it's telling, it was in Nature News 2023, AI beats human sleuths at finding problematic images in research papers. So I want to add AI beats human sleuth minus Elizabeth Beck, right? Because there's still no AI beating Elizabeth Beck. She's still unbeatable. But she confirms a lot of the finding that the AI has found. And she's like, oh yeah, I wouldn't have looked into it. But that doesn't mean I wouldn't have found it, right? Like it's a different thing. But now it doesn't help with everything, right? Like there's many things that I haven't mentioned and I could spend hours on, like citation manipulation, there's citation cartels, and we use the word cartel for a reason. Some people who found this actually got death threats too. It's kind of crazy. There's people paying other scientists or discussing with other scientists to cite each other all the time. So for instance, in a chemistry paper recently, I found a reference to a paper, the title was Mining Key Classes in Java Projects. Had nothing to do there, and it was just one of these citation cartels that was coming. But we found worse than this. God, this one was bad. So this is from this paper that we published recently with Guillaume and some other folks, in which we actually, and this is a complicated figure made with LaTeX, kudos for that, to Cyril, he did it all by himself, but we found that a paper that had, according to some dashboard, 107 citations, according to Google Scholar, had 0. So there was a mismatch between the number of references of some dashboards and Google Scholar. It turns out that this happened because the PDF, although these papers that supposedly cited the initial paper, it's called paper 1, did not contain references to paper 1, ever. So there were 107 papers that were said to cite paper 1 that never did. And it turns out what has happened is these other dashboards, other than Google Scholar, they don't rely on text processing. They rely on metadata. Metadata is sent to Crossref, from the publishers to Crossref, and from Crossref to all of these dashboards like Dimension, Springer Link, the Lens, all of that. So all of these dashboards will count 107 citations, but they don't exist anywhere. They only appear in the metadata of these 107 papers. And so the manipulation in this case doesn't come from authors. It comes from the editors of the journal directly, which is next level. And so in some cases, it's just mistakes. It has happened. We found here a paper that had 150 references in the PDF/HTML that had 300 in the metadata. But I think from my experience working with some journals, it's just the software they're using is a very slow web interface. And you copy paste 150 and it takes 3 seconds. You're like, oh, come on. And you press a second time and then you duplicate. And you see here, it was multiplied by 4. So easy mistakes. But it's not just that. From the set of extra sneaked references that we had found, this guy Jay, Nagaswara, Rao got an extra 3,103 citations. So it did benefit some researchers. So there's definitely something fishy going on. And for that, AI can't help us yet. We're trying to find a way to detect those automatically, because this was a case of pure luck, right? The paper, initial paper, cited 107 times, were flagged for tortured phrases. And I was like, oh, if it's cited by 107, I look into the 107 one citing it, they're probably also fraudulent. Then I couldn't find them, and then I pursued this thing, and it was really luck that we found this. But now we're trying to find a better way of finding those through potentially AI. All right, wrapping up time. I think that goes without saying. I think it's really important to correct the scientific literature. We should all be trying to do it, and actually it's kind of part of our mission to maintain integrity of the scientific record. It's implied, but it's part of it, right? And we should have a better error checking culture in academia. That means looking at our past paper and trying to figure out if something went wrong more often, not just peer reviewing the surface, but actually going deeper into the data, the analysis, and all of that more often. But again, there's no time for this, so we don't do it, unfortunately. If you do that work, I can tell you we'll get close to 0 credit for it. Actually, it will be worse than that. You will get threats from a couple of people. When we published this sneak reference paper, the editors of the journal that we found that in emailed us saying, delete your preprint as of now, and I'm quoting, or there will be legal consequences. So we took a screenshot and we posted it on Papier, and we had a good laugh with it there. But you will often get these kind of emails, which is not great. And I can tell you, editors and publishers are not going to be very happy about the work that you do if you do this. All they want to do is publish, 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 because that's where the money is, right? Retracting a paper, correcting a paper brings nothing to them whatsoever. They don't care about good science. They stopped caring a long time ago. Really, there's some good publishers out there, there's some good journals, there's some good scientists, but whenever you involve professional editors-in-chief, you can be sure that they don't give a damn about it, unfortunately. The way I describe it often, this whole like finding fraud and people cheating, is that it's a little bit of a rat's race, right? It's like the police finding new ways to find cyber fraud, and then the fraudsters finding new ways to cheat despite all these new security methods and all these identification methods. And it's kind of like that, right? Like now that we've unveiled tortured phrases and sneak references, people will stop using that to a degree. The most, let's say, not super intelligent one of them will continue using it and will still think that they're not going to be found, but they will. But some people will move on to other techniques, right? So we need a lot of help with that. So if you want to join us, just let me know. I'll be happy to bring more people on board. If you do join and if you do criticize paper, there's one crucial piece of advice. And he says it a lot better than me. So I invite you to take a look at his talk. The title says it all, really. This is how you should act when you criticize paper. It's a really nice talk about how to be skeptics without being an ass, pretty much. So I invite everyone to take a look at this talk. It's really, really cool. Summary very rapidly. All of these things that I've mentioned, they existed before COVID. COVID was just kind of like a magnifier, a catalyst of some of these methods. And they exist mostly because all we care about in science is metrics, right? Like all these H-index, impact factor, citations, number of papers per year. I mean, people wouldn't cheat if the systems were not giving incentives to cheat. So maybe we should stop the whole publish or perish at some point. It's we've seen all the flaws that go with it. Maybe it's time to think of something else. But how to scale that up? People have tried something else before. It is really, really hard to scale. So I don't have an answer, but maybe collectively, as this community of PhDs and super intelligent researchers, I'm sure we could think of something better. It doesn't seem too hard. Lots of people have talked about it a lot better than me. They are better with words and with, they said it a lot before that. I even said it, like this is from 2007. So do read on that as well. It's pretty cool. And happy to take questions and connect on LinkedIn or any other thing you want, because that's where I do most of it.
Let's open up for viewers online to ask or type questions before we move on to the audience here in the room. So if you're online, you can speak up or type your question. I'll give you a few seconds.
Maybe we could take one from here in the meantime, no?
Let's give them a couple of seconds and then we'll go to Philip. All right, Philip.
Regarding the idea of diversifying the interpretation of a retraction,
Yeah.
Is there any like talks or discussions about the terminology for that? Like for being discharged from the military, you would be dishonorably or honorably discharged?
Yes. So there hasn't been talks really about this. There's confusing wording. Actually, publishers are not even agreeing. Even within the same publisher, they use withdrawn, retracted, removed. So on the problematic paper screener that I showed, we aggregate all of these with a term that we called like annulled, I think, which is like to cancel something, which is not great. But this is something we actually suggested with Elizabeth and Gideon, one of my co-authors, a couple of times, that there should be like, maybe we should say, retracted dash fraud or retracted dash mistake, or use one word for mistakes, one word for fraud, because these are different. And there are cases, I guess, where you can't really know what it was. It has happened.
But still, some mistakes are more egregious than others.
Agreed. There's a spectrum of questionable research practices, and some are a lot worse than others. I mean, all the retraction notices do contain the explanation, right? If you go on like when it's written retracted and you scroll down a bit, they explain why the paper was retracted.
Yeah, but that doesn't fit nicely in the text.
Exactly. Yeah. There should be something, but sometimes it's so hard. So some of the papers that I've gotten retracted recently, some of the cases, like the one from the institute that promoted hydroxychloroquine, they got retracted for two reasons: lack of proper ethics approval, which is unethical research, which warrants in and on itself a retraction, but also an independent investigation within the home university that actually concluded that this is illegal research. So it goes beyond being not ethical, right? They conducted illegal human experiments that warrants criminal cases and criminal trials. And so they have to explain that there was an independent investigation from someone else, the government, etc. How to put that into one sentence is complicated. But the retraction notice contains info. But yeah, I agree. Yes, Tina.
Why do I put fake authors on my paper?
Oh, very good question. So there's two reasons. So there's entirely fake author teams, which exist for the reason I get into after, but you would put fake authors on your paper to build a reputation / past for them, so that then you can have fully fake paper with just fake authors. And then these fake authors can cite your papers. And so that increases your citation numbers. Aha, there you go. And I mean, it's all like, that's how crazy it is. But like, we go into creating fake profiles so that we can get more citations on our own paper. I mean, it's insane. That's insane. That's someone who came up with the idea. I mean, but yeah.
People are doing that by the thousands in social media.
Oh yeah.
By the hundreds of thousands.
Of course. So obviously it would come here too. That makes sense. But I mean, it's the system that we have of evaluating the work that we do is so, when you think about it, it's so stupid that people would go to these lengths to actually get promoted or get a grant. And I think that's nonsensical, right? Like the whole idea of a number is going to tell you how productive I am as a researcher, when even I can't say myself about my own career if I'm being productive. Even looking back, like, was I productive in 2020? I don't know. If you look at number of papers, yes. But were these happening because there was a tally of papers that I couldn't publish before and they all got published, like the catch-up effect, like, I don't know. It's so complicated. And we have thought as a community, yes, we'll sum it up to just metrics. That seems so wrong, honestly. But yeah, the whole fake thing is crazy. And the citation rings and cartels and all that, it's insane. It's sometimes just agreements, right? Like I tell you, hey, Tina, don't you want to cite this one paper that's not really anything to do with your research, but like cite it in all your papers and I'll cite one of yours. That's tacit agreement. It's very hard to find. Super hard, even when you find it, super hard to argue it's actually done on purpose and there's any connection between us, because if I'm smart enough, I will never send you an email about it. I will just, have a coffee and like, hey, Tina, what do you think about that, right? And then no one will ever know. But it does happen that it goes like to extreme cases of people like, as I said, like chemistry papers citing computer science papers. It's
how much of this, all of this,
do
you find in our community of graphics and visualization?
Let's
go really to the...
So far, 0. I know of one case of fraud that happened years back. I think everyone knows. You probably know about it too.
I actually don't. I should. Okay.
I think this
we'll talk over.
Yeah. I think there's one that everyone knows-ish, without really knowing. But But overall, no, I think one of the main issues, all of these things that I've shown, they're in big communities, right? Communities that are like the number of scientists is counted by the dozens of thousands.
Yeah.
Our community is like 2,000, including all grad students and everyone, right? Like, this is super tiny. If tomorrow I cheat, everyone knows. Right? If tomorrow you cheat, same thing. You go to the VIS conference and people look at it like, oh, it's Tino the cheater. Like, that would be like this, right? Telling their students, don't work with him. Don't go do a postdoc with him. No.
Don't take this out of context.
No, but you know what I mean, right? Like it's too small. It's too small. In the communities that I've talked about, like the one, so Didier Raoult, for instance, big researcher in a field that has hundreds of thousands of researchers. So if he goes to a conference, the likelihood that someone knows what has happened recently in the last 3 years is fairly small, even with all the crazy international coverage that it's had, like The Guardian and all of that. You can still go to a conference almost unnoticed. So why would anyone see or know that someone cheated in a big community? And people are betting on that. Or other factors. There's also other factors that count, right? Like they also think they're never going to get caught. And if they do, if they're professors, it doesn't matter. Really, it doesn't. There was Francisca Gina recently. I can talk about it now because she lost her lawsuit, so perfect. There's the guys at Data Colada in the US, it's a blog and team of researchers that like to investigate fraud. And they looked into the case of Francisca Gina. She's a professor at Harvard, and she's working on honesty. The irony. Wonderful. And she actually massaged her data a lot, like so much that she actually recreated everything to like have the results she wanted. And the Data Colada folks, they found this because they looked into the Excel spreadsheet that she submitted along with the paper. And I think Francisca Gino forgot that there's a history of modifications. So they just went through the history. And they thought, well, this number was not here at the beginning. How did it get here? And she just manipulated all the numbers. They found this, they talked about it. She sued them for defamation. And in the US, that's expensive. So we started GoFundMe for them, and they got all the money for it, and it was good. And eventually the judge dismissed the whole case, but they still had to pay all the legal fees first because that's the US, right? You pay first. America. So they had to, I think it was like $200,000 they had to put forward. It's like to defend themselves. And you know, Francisca Gino's excuse was like, I didn't do anything. It was my grad students. I mean, in all your papers, every single grad student cheated. I mean, either you're really good at picking cheaters or you did it yourself. Turns out in the modification history, it's written Francisca Gino. So,
yeah. Or that she instructed them.
Or she instructed them, right? Because then this whole culture, and then, you know, the students are blamed, and then you can be like,
what if it's her name in the history?
Yeah.
But in this case, yeah.
Via the history, I found a master student actually doing that.
I'm going to invite all of us to continue the conversation, but I want to let the folks online who, you know, thank you. I thank you here.
Thank you, Mario.
Everyone. And everyone, thank you so much. Continue the conversation. I will stop the recording now.
Yes. There are messages in the chat.
That's
That's you.
Yeah, those are